First, we'll start with the sense of smell. Can you smell this?
Mm-hmm.
Good. And close the other side. Can you smell it now?
Mm-hmm. Again.
Okay, good. Why don't you put your glasses on? And we're going to test your vision. You need to follow the directions on the card, but this one requires that the card be about 14 inches away from the patient. Cover your left eye. Can you read the numbers on top of my finger?
Mm-hmm. 63925.
Good.
428365.
The next line?
374258.
Excellent.
62. Okay. Let me start again. I'm not sure if that's a 6. Okay.
It's fine to skip it.
Blank 27. Blank 26.
Good. How about down there?
Blank 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 7 blank blank.
Good. So she read most of the 2025 line and got one letter on the 2020 line. And cover your right eye.
Oh, the other right. Okay. 37429.
Good.
8676 blank.
Okay.
4 blank 4 again 4 7 blank blank.
Okay. And again, almost completely read the 2025 line or the Jaeger 1 and a couple of numbers on the 2020 line. Good. Cover one eye again. You can take your glasses off.
Okay.
Okay. If you look right at my nose, can you see my whole face?
Yeah.
You see all parts equally well?
I can see your nose a lot better.
Thank you. Any parts missing?
No.
Good. So keep looking me right in the eye. Tell me how many fingers you see.
2
Good. Now?
3
Perfect.
4
Good. Look me right in the eye. Tell me when you see my hand coming in from the side.
now. 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 Actually, that one I saw
Okay.
from afar. Oh, now. Now.
Good. And the other eye. So again, we'll start with the face. The face is a nice reference for the central part of the visual field. It screens about the central 20 to 25 degrees. Cover your left eye. And if you, we didn't do that, right?
No.
Okay, if you look at my nose, can you see my whole face?
Yeah.
See all parts equally well?
Yeah.
Any parts missing?
No.
Okay.
Well, yes. That ear.
Ear is missing. Okay.
That ear is not shown.
Okay. Look me right in the eye. And tell me how many fingers you see.
4 2 3.
Good. Keep looking me in the eye and tell me when you see my hand.
I can see it. I can see it now. Okay, I can see it. I can see it. I can see it.
All right. Okay. Good. Now follow my finger with your eyes. Look way over here to your left.
Okay.
And follow over here to your right. To your left again. And over here to your right. Good. Look way up. And way down. All the way down. Good. Look at my finger. And look at my nose. At my finger again. At the nose. The finger. Nose again. Finger over here to your right. The nose. Finger. Nose again. Hold your lids open. At my finger. At the camera. Finger again. And at the camera. Good. Okay. We're just going to examine her pupils. First we're going to look at the size of the pupils. And we can actually measure them and see how big they are. So the right pupil is about 5 millimeters. and the left pupil is about 6 millimeters. Keep looking straight ahead. We're going to see how they react to light. Then we're going to swing the flashlight straight ahead again from one eye to the other to see if there's an afferent pupillary defect. And what you should see is initial constriction of the pupils, and then you may see just a little bit of dilation. Good, that looks normal. Gonna take a quick look in her eyes with the ophthalmoscope. Just look straight ahead. Good. Straight ahead again. Okay. The fifth cranial nerve supplies sensation to the face, sensation to the cornea, and motor function to the masseter and pterygoids. So first we're going to work on the trigeminal sensory portion. Can you feel this over here? Is it sharp?
Mm-hmm.
And over on this side?
Yeah.
So we would do the first division, the second division. Is it sharp over here?
Yes.
And over here?
Yes.
Sharp over here?
Yeah.
And over here. Feel the same on both sides.
Mm-hmm.
Good. To test the pterygoids, can you move your jaw to one side? And hold it there. Don't let me push it back.
Which way did I
Either way. To the right. Good. Move it to the other side. Good. And for the masseter, open your mouth real wide. Don't let me push it closed. Good. Now, to test the corneal reflex, you can either use a Kleenex and make a little wisp of Kleenex, or you can use a cotton swab. And the idea is to be very gentle. And what we're looking for is that, first of all, the patient should feel the stimulus, and then they should blink both eyes in response to it. Look way up at the ceiling. Way up again. Good. Okay, moving on to the facial nerve, which supplies motor function to the muscles of facial expression. So first we're just going to look at the face and make sure it's symmetrical, looking at how far the eyes are open and also the nasolabial fold to make sure that that's symmetrical. And then we can test the strength of the muscles. So close your eyes real tight. We're testing the orbicularis oculi, tight as you can. Don't let me open your eyes. Good. And keep them closed tight. Normally when someone closes their eyes tight, they should pretty much bury their eyelashes. Open your eyes real big.
They don't have lashes.
Open real big. Good. Wrinkle up your forehead. Good. And again, they should lift up the brows, and you should see the wrinkles equally on both sides. Show me your teeth. Good. Okay. Moving on to the eighth nerve, we test hearing, and there are various ways to test this. Can you hear this?
Mm-hmm.
And over here? And most patients can hear the rubbing of the finger. To go on to the ninth and 10th cranial nerves, they supply the movement of the palate and to some extent the ability to swallow. To test the gag reflex, again, we're going to be very gentle and use a Q-tip. Open your mouth again. Stick your tongue out at me. Can you feel that in there?
Uh-huh.
Can you feel it in there?
Uh-huh.
Okay. And notice she didn't gag, and about 25% of people will not gag in response to that stimulus. For the 11th cranial nerve, that controls the sternocleidomastoid and the trapezius. So to test the sternocleidomastoid, turn your head all the way to one side, and we're going to be looking at the contralateral sternocleidomastoid. Don't let me push it back. Good. Same thing on the other side. And hold it there real strong. You can see the muscle over here. Good. For the trapezius, shrug your shoulders up. Don't let me push them down. Good. Okay. And lastly, for cranial nerve 12, controls movements of the tongue. So, open again, stick your tongue straight out, and we want to check and make sure that the tongue is midline. Can you move your tongue from side to side? Okay. Say me, 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 me.
Me, 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 me.
La, 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 la.
La, 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 la.
And ka, 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 ka.
Ka, 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 ka.
Good. So the articulation is normal. Okay, we're going to start the motor exam by testing the tone, which is the most objective part of the motor exam. Tone is the resistance to passive movement, so we're going to have you relax, and I'm just going to move your limbs around, and it should feel nice and loose, and she shouldn't be giving me abnormal resistance. Absolutely. Troublemaker. Relax your legs. I'm just going to move your legs around a little bit. Good. Nice and loose. Okay, good. And we'll start the strength testing in the upper extremities. I prefer to test strength from side to side. It makes it easier for me to compare, but you'll develop your own style. I also prefer to start distally and work my way proximally. So we'll start with the interossei. Spread your fingers real far apart. We're going to put the muscles in their position of action, and then we're going to have the examiner will try to overcome that. Don't let me push them together. And hold them up like you're stopping traffic. Finger extensors. Don't let me push them down. Same thing here. Good. Curl your fingers up around my hand. The finger flexors. Don't let me straighten them. Ready? Good. Same thing over here. Pull it in. Cock your wrist back. The wrist extensors. Don't let me push them down. Same thing over here. Good. And flex at the wrist. Don't let me pull it up. Good. And over here. Good. Next we're going to go to the biceps and the brachioradialis. They're innervated by the same nerve root, but a different peripheral nerve. And they're tested just slightly differently. To test the brachioradialis, we want to make a fist. And then pull your arm in so that the base of your thumb is toward your shoulder. Don't let me pull it. Ready? This is brachioradialis. Same thing over here. Good. And to test the biceps, we want the fingers curled in towards you. Same thing over here. Good. Now the triceps straightens the arm, so there are a couple ways to test the triceps. If we want her to put the muscle in its position of action, we're going to have you straighten your arm, and don't let me bend it. Right? So we're not going to have you lock the arm, but make it straight and don't let me bend it. Right? Good. Same thing over here. Don't let me bend it. Now the other way to test the triceps is by starting the arm from a flexed position, which is a little more difficult to appreciate. Push me away. Same thing over here. Push me away. Push, 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 push hard as you can. And again, it's a little harder to determine sometimes what's normal, what's abnormal when you test it that way. To test the deltoids, the wings, hold your wings up strong. Good, and then we're going to look for a pronator drift, which is a sign of upper motor neuron dysfunction. We're going to have your hands up towards the ceiling, close your eyes, and I'm going to let go, just hold them right there. Now if this was abnormal, the arm would relax. I'm just going to do it for you. Hold them both up. Close your eyes. The arm would pronate and it would drift downward if there was upper motor neuron dysfunction. Good, you can open your eyes. And we're going to go down to the feet. Right? Pull your big toe back towards your head and don't let me push it down as strong as you can. Good. Same thing over here. Pull back towards you. Pull all your toes back towards you. Same thing under here. Pull them all back. Pull your whole foot back towards your head. Good. Same thing over here. For the foot flexors, the foot extensors. For the foot flexors, step down like you're stepping on the gas. Good. Same thing on this side. Step down. Okay. A little better on the left. Keep your legs straight. We're going to test the quadriceps. Don't let me bend it. Same thing over here. Good. And bend your leg back for the hamstrings. Pull all the way in. Don't let me straighten it out. Ready? Same thing over here. Pull it in. Good. And then the iliopsoas lifts up the lower limb, so lift up your knee. Don't let me push it down. Same thing over here. Don't let me push it down, right? Again. Don't let me push it down. Right? Now we're going to do the sensory exam. There are two major pathways for sensation, the spinal thalamic pathway and the dorsal column pathway. The spinal thalamic pathway carries pinprick and temperature sensation, and the dorsal column pathway carries vibration and proprioception sensation. So we're going to make sure that we cover all pathways. So starting with the pinprick, we're going to start again distally and work our way proximally. A lot of the sensory exam depends on what you're looking for. If you're looking for a problem in the brain, then you may be more interested in comparing one side to the other. If you're looking for a nerve root problem, then you may be more interested in a dermatomal pattern. Again, you'll know by taking your history what you'll be looking for, and that will help you. Okay, is it sharp down here?
Mm-hmm.
Is it sharp all the way up?
Pretty much.
Okay. On the other side? Sharp down here?
Yes.
Sharp all the way?
Yes.
Okay. Does it feel the same over here and over here?
It's sharper on this side.
Okay. Same over here and over here?
It's sharper on this side now.
Okay.
I know.
Let's go down to the legs. Just let them hang.
Oh.
Feel sharp down here?
Mm-hmm.
Sharp all the way?
Yeah.
Sharp here?
Yes.
Okay. Sharp down here?
Yes.
Sharp all the way up?
From here to here, that's sharp.
Okay. I'm just going to go around on the other side. How about now?
No.
Not sharp or?
Not sharp. Down here it's not sharp.
Okay. Is there a difference between this side and this side?
They're both pretty dull.
Okay. Is there a difference between here and here?
Yeah. Yes, there is.
What's the difference?
On this side it's sharper.
Okay. Tell me when it gets sharp.
No.
Not sharp.
Well, now it's sharp. Down there it's sharp. A bit sharp.
Huh?
A little bit.
Okay.
Yeah. Yes. No.
No?
Oh.
Yeah.
Yeah.
Okay.
Yes.
So we are able to outline an area of numbness that, in this case, doesn't really conform to any particular dermatomal pattern. Okay. I have a finger. Can you feel vibration?
No. Yes. Yes. No.
How about now?
Yes.
Okay. Tell me when it goes away.
It's going away.
Gone?
Gone.
You feel it here?
Yes. Now I do.
Tell me when it goes away.
Now.
Okay. Same thing over here. Feel the vibration?
No, not really.
Feel it here?
Not really. Yes.
Tell me when it goes away.
Now it's gone.
Okay. So there's decreased vibration sense in the left arm up to the wrist, and there's decreased vibration sense in the fingers that's intact in the hand. In the lower extremity, we always use the big toe. You feel it?
No. Hit it again.
Okay. Feel it now?
No.
No. Feel it here.
Yes.
Tell me when it goes away.
Okay, it's gone.
Feel it over here? Feel it over here?
Yes.
Say one.
Okay, so it's about finished.
Okay, good. Now, we're all blessed with very good proprioception sense. We know where our body parts are at all times. And so we are able to detect very small degrees of movement in our digits and in our joints. So close your eyes. I'm going to take your ring finger, and I'm going to move it either up or down. Just tell me which way you feel it moving, okay? Now.
Down.
Now.
Up.
Now.
Up.
Now.
Down.
Perfect. Same thing with the other hand. Ready? Now.
Up.
Now.
Down.
Now.
Down.
Now.
Up.
Now.
Up.
Good. And you may not have even seen much movement on the camera, but she was able to detect it. And notice that my fingers are on the side of her fingers so that she doesn't feel the pressure. She only feels the movement up or down. Now we're going to go down to the big toe and do the same thing. Ready? Close your eyes. Tell me which way your toe is moving. Now.
Up.
Now.
Down.
Now.
Down.
Now.
Up.
Good. And the other toe?
Down.
Now.
Up.
Now.
Down.
Now.
Down.
Great. Okay. Lastly, we're going to do a couple of special sensory tests that look for primarily parietal lobe dysfunction. One is called graphesthesia, which is the ability to perceive something that's written in your hand without actually looking at it. So you're going to do it just by feel. So what I'm going to do, and you can watch, is I'm going to not really write a number in your hand because there's no ink, but I'm going to pretend I'm writing a number in your hand, okay? Like that would be a 3, okay? It'll be facing you.
Right.
Close your eyes and tell me what number I'm writing in your hand.
6.
Good.
And do it again. 9.
Okay, and with the other hand?
7.
Uh-huh.
2.
Good, okay. The next is called stereognosis, which is the ability to recognize by feel something that's placed in your hand. Again, this is one of those findings that we can see with parietal lobe problems, particularly the non-dominant parietal lobe. So close your eyes again. I'm going to put something in your hand, and you can feel it, and tell me what it is.
String.
You use your fingers.
Oh, okay. Oh, it's rubber band.
Good. And with your other hand? Go ahead, use your fingers.
Paper clip.
Perfect. Okay. Every muscle has a reflex, but there are a few that we routinely will test. And we're going to start up at the top with a jaw jerk that has its innervation by cranial nerve 5. Both the afferent and the efferent limb of the jaw jerk are cranial nerve 5. And an abnormal jaw jerk is characterized by an exaggerated opening of the mouth when the chin is percussed with the reflex hammer. Open your mouth just a little bit, and I'm going to put my finger right over here on her chin and just hit my finger. And if she had an abnormal jaw jerk, her jaw would jerk open. Next, we're going to move down to the arms with the brachioradialis reflex. There are a couple of different ways to test this, and I'll demonstrate both of them to you. Let your arms hang, go really loose, and I'm just going to hit right over there on the brachioradialis tendon, which is about where the wristwatch usually is. And you can see that the arm jerks a little bit, and in this case you can see her fingers also curling up, which is an exaggerated response of the reflex. The other way to test for this is just relax, let your arm hang in mine, and I'm going to support her arm and again hit in just the same exact place. So you can do this either way. Let's do facing the back to the camera. Okay, for the biceps tendon is right over here in the crease of the arm. So if you need to have the patient's arm bent and relaxed. And again, I'm going to put my finger over here right on top of the tendon and hit it. And you should be able to see the forearm jerking in response to the biceps reflex. Just relax. And then just sit right here. You see that? I'm on the way.
It's okay.
You can see it?
You can
Okay.
see the left arm.
The triceps, again, there are two ways to test it. And this, I think, is the hardest reflex to do. The triceps tendon is right over here above the elbow. And you can either do it with, you can test it with either the arm bent or with the arm suspended. So to test it with the arm bent, just make sure the patient's relaxed. You want a nice bend in the arm. You're going to hit right over here. And again, you'll be able to feel it and you'll be able to see it. The other way is to actually suspend the arm, which sometimes works a little bit better. Just relax. I'm going to hold your arm up, okay? Just let it hang in my hand. And the advantage is that you can see the movement of the forearm a little better this way. Let it hang. Relax. Okay, very good. Going down to the lower extremities, the knee jerk and the ankle jerk. Just let them relax. Good. For the knee jerk, we're going to hit right below the patella. Notice you never stand in front of the patient. Good. And for the ankle jerk, we're going to flex the foot just a little bit and hit right in the back of the ankle where the Achilles tendon is. Okay. The last part of reflex testing is looking for pathologic reflexes, which includes the Babinski sign. And the correct way to test for the Babinski sign is with the patient lying down. You want to take a fairly noxious stimulus. It's not really supposed to tickle. And move the stimulus up the side of the foot and across the ball of the foot. And an abnormal response, which is what you see here, is that the big toe will extend and the small toes will fan. So we'll do that again. And on the other side, just relax. Next is the cerebellar exam, and the cerebellum controls our balance and our coordination. So when we do cerebellar testing, we're looking at the flow of the movement and the accuracy of the movement and the rhythmicity of the movement. So we're going to start by having you reach out and touch my finger with your finger, and touch your nose with the same finger, and back and forth, my finger, your nose. Notice I'm really having to reach out, keep going, because most cerebellar problems are visible at the end points of the movement. Good. And with the other hand. Okay, good. Next is more fine motor movements. Can you go like that? See the little joint on your thumb? Hit the same place each time. Good. And with the other hand. Okay. So rapid alternating movements. Hold one hand still. Flip the other hand on top of it. Hit one hand and then the other. And again, as you listen, it should be rhythmic. Good. Switch sides. Okay. To test the coordination in the lower extremities, we test heel to shin. What I'd like you to do is take your heel, put it up here on your knee, and run it right up and down the front of your shin, nice and neat. Keep going. Good, and with the other leg.
Okay, I got it.
All the way down. Good, all the way up. All the way down again. Way up. One more time. I remember. Okay. Just walk normally. Good, and turn around. Good, come on back. Can you walk on your tiptoes? Good, now up on your heels. Good, and turn around again and walk back normally. And come on back down the hall. Can you walk with one foot right in front of the other one? Heel to toe, like you're walking on a tightrope. Okay, and stand with your feet together.
I'm sorry.
Stand with your feet together. Or however you're comfortable. You feel pretty steady?
Mm-hmm.
Close your eyes.